Good morning everyone. In this video we will learn about the posture. Posture refer to the way we hold and align our body during standing, sitting and lying positions. Maintaining good posture is essential for proper body mechanics, efficient movement and overall health. Okay, in this presentation, we will discuss the definition, types of posture, then postural mechanism, pattern of posture, and characteristics of good and poor posture, factors affecting posture, and the importance of maintaining correct posture in daily life. Next, we will look at the definition. Posture is the position or alignment of the body and its parts in relation to each other at a particular time. It refers to the way we hold our body while standing, sitting, lying down, or perform any activity. Good posture maintains proper alignment of bones, muscles, and joints, reducing strain on the body and promoting efficient movement. Maintaining correct posture is important for overall health, balance, and prevention of musculoskeletal problems. Next, we will look at the types of posture. Posture can be classified into two main types: active posture and inactive posture. First, we will look at the inactive posture. Inactive posture, also known as a relaxed posture, is posture maintained with minimal muscle activity in the posture. The body relies mainly on aligned ligaments and joint structures rather than active muscle contraction to maintain position. Examples include while standing or sitting in a relaxed manner for a long period. Although inactive posture requires less energy, maintaining it for a prolonged period can lead to poor alignment, muscle strain. These are the attitudes adapted for resting or sleeping, and they are most suitable for this purpose when all the essential muscular activities required to maintain life is reduced to minimum. The posture used to training and general relaxation fulfill this condition. Next, we will look at the active posture. Active posture is a posture maintained by the continuous activity of the muscles to keep the body in proper alignment. In this posture, muscle work actively to support the body against gravity and maintain balance. Active posture which may be static or dynamic. Next, we will look at the static posture. Static posture refers to the alignment and position of the body when it is at rest and not moving. It is maintained during activities such as standing, sitting, or lying down. Good static posture keeps the body part properly aligned, minimize stress on muscles and ligament, and helps maintain balance with less energy. Okay, next. Examples of static posture include standing upright sitting correctly in chair and lying in proper sleeping position. Maintaining good static posture is important for preventing pain, fatigue, and musculoskeletal disorders. Next, we will look at the dynamic posture. For the movement of the pattern of the posture is constantly modified and adjusted to meet the changing circumstances which arises a result of movement. Dynamic posture Dynamic posture refer to the alignment and positions of the body during movement. It is the posture maintained while performing activities such as walking, running, bending, lifting, and climbing stairs. Good dynamic postures allow the body to move efficiently with proper coordination, balance, and minimal stress on the muscle and joint. It helps prevent injuries and improves overall movement performance. Examples of dynamic posture include maintaining an upright trunk while walking and using proper body mechanics while lifting an object. Therefore, dynamic posture is essential for safe and efficient movement in daily life. Examples for static posture: standing upright, sitting correctly in a chair, and lying in a proper sleeping position. Maintaining good static posture is important for preventing pain, fatigue, and musculoskeletal disorder. Next, we will look at the postural mechanism. Postural mechanism are the automatic process that help maintain body posture, balance, and stability against gravity. They enable us to stand, sit, and move without falling. The main postural mechanism include postural tone, righting reactions, equilibrium reactions, and protective reactions. First one is postural tone, a slight continuous muscle contraction that helps maintain posture. Then second one is righting reactions, that is automatic movements that keep the head and body in proper alignment. Equilibrium reactions, responses that help maintain balance when the body's center of gravity changes. Fourth one is protective reactions, automatic movements such as extending the arms to prevent injury during the fall. The mechanisms work together to maintain posture, balance, and coordinated movements during daily activities. Now that we have understood the postural mechanism that help maintain posture and balance, let us move on the nervous control of posture and see how the nervous system coordinated these activities. Posture is controlled by nervous system through the coordinated action of the brain, spinal cord, muscles, and sensory receptors. The cerebral cortex helps in voluntary control of the posture and movement. The cerebellum coordinates muscle activity and maintains balance. The basal ganglia regulate posture and muscle tone. The brainstem helps control automatic postural adjustment, while the spinal cord carries signals between the brain and muscles. Sensory information from the eyes, inner ear, and muscles and joints provide feedback about body position. The nervous system processes this information and make a necessary adjustment to maintain posture and balance. Thus, nervous control is essential for maintaining proper posture during both rest and movement. Now that we have discussed the nervous control of posture, let us look at the normal pattern of postures. An afferent response to the afferent stimulus. Afferent stimuli arise from variety of sources all over the body. V muscles, neuromusculars and neurotendinous spindles within muscles record the changing tension. Increased tension result into the reflex contraction of muscles like stretch reflex. Visual sensation records any alteration in the body position with regard to surrounding and help the restore body in erect position by activating righting reflexes. All the sensation and information are conveyed and coordinated into central nervous system. The ears. Stimulation of receptors of the vestibular nerve result from the movement of fluid of semicircular canal of internal ear. Each canal lies in different plane and any movement of head disturb fluid they contain. It gives knowledge of movement and the direction. Next we look at the joint structure. The weight bearing position approximation of bone stimulates receptor in joint structures and elicit reflex reaction to maintain the position. The last one is tactile stimulation. Now that we have discussed the nervous control of posture, let us look at the normal pattern of posture. Pattern of posture, both static and dynamic, are gradually built up by integration of many reflexes which together make up the postural reflex. Some of them are inborn and some are conditioned. Pattern of postures refer to the normal alignment of body segment in relation to each other when viewed from the front, side and back. In an ideal posture, the head is held erect and balanced over the shoulder. The shoulders are level and slightly back. The spine maintains its normal curves. The pelvis is in neutral position. The hips and knees are straight. The feet are placed evenly on the ground. A good postural pattern ensures proper balance, efficient movement, and minimal strain on muscles and joint. Any deviation from this pattern may lead to postural abnormalities and musculoskeletal problems. After understanding the normal pattern of posture, let us discuss the characteristic of good posture. Good posture is the correct alignment of the body in which the muscles, bone and joint work efficiently with minimum strain. The characteristic of good posture include head held upright and balanced, shoulder level and relaxed, chest slightly elevated, abdomen flat and firm, normal spinal curves maintained, pelvis in a neutral position, Hips and knees straight but not locked. Body weight distributed evenly on both feet. Good posture improve balance, reduce fatigue, prevent pain, enhances breathing efficiency and promotes overall health and confidence. Now that we have learned about good posture, now we look at the development of good posture. A stable psychological background, good hygienic conditions, opportunity for plenty of natural free movement. Now that we have learned about good posture, let us discuss poor posture and its effect. Poor posture is an incorrect alignment of the body that places excessive stress on muscles, ligaments, and joints. Posture is poor when it is inefficient, that is, when it fails to serve the purpose for which it was designed, or if unnecessary amount of muscular effort is used to maintain it. Common features of poor posture include forward head position, rounded shoulders, excessive curvature of the spine, uneven weight distribution. Poor posture can lead to neck pain, back pain, muscle fatigue, joint strain, reduced breathing efficiency, and decreased physical performance. Therefore, maintaining good posture is important to prevent these problems and promote overall musculoskeletal health. Good posture, balanced upright postures with the shoulder down and relaxed. Poor posture, sway back posture with rounded shoulder and overarched spine. Correct sitting posture. Next, we look at the factors which predispose to poor posture. General causes, mental attitude, poor hygienic conditions, prolonged fatigue. Local factors are localized pain, muscular weakness, occupational stress. After understanding good and poor posture, let us discuss the principles of postural re-education. Cause must be treated first. Success of any physical treatment invariably depends upon ability to gain the cooperation of patient by therapist. Remedied permanently by an alteration in mental attitude, by improving the hygienic condition. Relaxation and mobility exist for improving and repeated presentation of satisfactory postural pattern. Postural re-education is the process of correcting faulty posture and developing proper postural habits. The main principles of re-education are awareness. The patient should recognize the postural defect. Second one is correction. The faulty posture should be practiced regularly during daily activities. Muscle strengthening. Weak muscles should be strengthened. Fifth one is stretching. Tight muscles should be stretched to improve flexibility. Sixth one is balance and coordination training to improve postural control and stability. Last one is habit formation. The corrected posture should become a regular habit. The main principles of re-education are awareness, correction, practice, muscle strengthening, stretching, balance and coordination training, postural control and stability, and habit formation. Now that we have discussed the principles of postural re-education, let us look at the techniques used to correct posture. Various techniques are used to postural re-education to improve body alignment and posture. The important techniques include postural awareness training, teaching the individual to recognize correct and incorrect posture, mirror exercises, using a mirror to provide visual feedback and help maintain correct posture, strengthening exercises, strengthening weak postural muscles, stretching exercises, stretching tight muscles that contribute to poor posture, balance and coordination exercise, improving postural stability and control, breathing exercise that promoting proper chest expansion and trunk alignment, functional training, practicing correct posture during daily activities such as sitting, standing, walking and lifting. Relaxation, voluntary relaxation of specific group of muscle can be taught and practiced so that the patients learn to recognize tension and it is able to relax at will. Mobility, normally maintained by general free exercise. Then muscle power, general muscle weakness is there due to poor posture. With the help of free movement and harmonious muscular development, it can be prevented. Then presentation of good pose. The physiotherapist must sell the patterns of good posture, then establishment of good posture by using audio visual instruments and giving seminar or presentation on good posture. Okay. After discussing the technique of postural re-education, let us see the presentation or characteristic of good posture. Good posture is characterized by proper alignment of all body segments with the minimum stress on muscles and joint. The presentation of a good posture include head held erect with the chin slightly tucked, shoulders level, relaxed and slightly retracted, chest elevated comfortably, normal spinal curves maintained, abdomen flat and firm, pelvis is in a neutral position, hips and knees straight but not hyperextended, feet pointing forward with body weight equally distributed on both feet. A person with good posture appears balanced, comfortable and confident. Good postures improve efficiency of movement, reduce fatigue and helps prevent musculoskeletal problems. This completes our discussion on posture and its importance in maintaining health and functional ability. First, let us look at the position of the head in good posture. The head should be held erect and balanced directly over the neck and shoulders. The chin should be slightly tucked in and the eyes should look straight ahead. The head should not tilt forward, backward or to either side. Proper head alignment reduces strain on the neck muscles, helps maintain balance and contribute to an overall good posture. Next, Look at the position. Next, look at the pelvic tilt in good posture. Discuss the pelvic tilt in good posture. The pelvic should be maintained in a neutral position during good posture. A neutral pelvic tilt helps preserve the normal curves of the spine and ensure proper alignment of the trunk and lower limbs. Excessive anterior pelvic tilt can increase lumbar lordosis, while excessive posterior pelvic tilt can flatten the lumbar curve. Therefore, maintaining a neutral pelvic tilt is important for balance, stability, and efficient movement. Next, let us discuss the position of the feet in good posture. The feet form the base of support for the body. In good posture, the feet form the base of support for the body. In good posture, the feet should be placed comfortably apart, pointing forward or slightly outward. Body weight should be distributed evenly on both feet. The arches of the feet should be maintained properly to provide stability and absorb shock during standing and walking. Proper foot alignment helps maintain the balance and support the correct posture of the entire body. Painless, mobile and strong feet from a stable base on which the weight of the body is balanced and supported. The arches are braced and the weight of the body transferred progressively from one part of the weight bearing area to the next during walking. Next, finally, let us discuss patient education, which is an important part of maintaining good posture. Patient repetition and precision, facilitation of neuromuscular pathway by coordinated impulses. Patient education helps individuals understand the importance of good posture and how to maintain it during daily activities. The patient should be advised to maintain correct posture while sitting, standing, and walking. Avoid prolonged sitting or standing in one position. Use ergonomically designed furniture whenever possible. Perform regular stretching and strengthening exercises. Avoid carrying heavy loads on one side of the body. Take frequent breaks during computer or mobile phone use. Follow the postural correction exercises prescribed by therapists. Proper patient education promote healthy postural habits, prevents musculoskeletal problems, and improved overall quality of life. Understand the importance of good posture, postural control, and postural re-education. Maintaining proper posture is essential for preventing pain, improving function, and promoting overall health. So the proper patient education promotes healthy postural habits, prevent musculoskeletal problems, and improve overall quality of life. Okay, thank you.